Hello and welcome to Askimo TV. I'm talking today to Saghar Kasiri. Saghar is a senior clinical embryologist and PGS/PGD coordinator at London Fertility Centre in Harley Street. She's been a specialist in the field of embryology for 18 years and worked in top IVF clinics in the UK. Saghar has made 4 TV programs on infertility, been interviewed by BBC, and written a number of articles on infertility and assisted conception techniques. Hi Saghar, how are you?
Hi Joanne, thank you very much.
Saghar, today we're going to have a discussion about IVF, in vitro fertilization. So I guess the first question is, what is IVF?
Basically, IVF is when a couple suffer from infertility and they can't get pregnant in a natural way. They can come to clinics, infertility clinics like ourselves in London Fertility Centre. We stimulate the ladies and get them to produce more than 1 egg. Once they have produced a good number of eggs in their ovaries, we retrieve those eggs by aspirating their ovaries, and at the same time we obtain semen from the male partner, and we put them together in a petri dish in the laboratory, and within a few days we hope to have embryos available to be put back for the patient. This is a very simple term of explaining what IVF is about.
What tests must a patient take before receiving IVF treatment?
Usually there will be assessments of the fertility potential of both the female and male partner. So, for example, for the female there will be some blood tests that she will do that will check her hormone levels, and also there will be some scan of her pelvis, her uterus and fallopian tubes to make sure that her reproductive organs are working well and intact, and at the same time checking the hormone levels, making sure that she can produce a good number of eggs, hopefully for the use for IVF. For the male partner, we also look at the assessment of their sperm. We check things like morphology, the count of the sperm, how well the sperm is swimming, and the volume of it. These are some of the things we can check in the lab. Other assessments that we also do is the blood screening of the patient. For example, we check for the HIV and hepatitis status for the patient. Sometimes we may have to use a bit more detailed test if we find that there is a specific problem with the patient.
What are some of the possible complications of treatment by IVF?
There isn't a lot of serious complications with IVF, luckily. We have some obviously risk associated with the drugs that we use for stimulating the patient, which could cause what we call hyperstimulation of the ovaries. But this is only in very small percentage of patients. Usually by doing that hormonal test that we do first, we should get some idea about which patients would be more at risk of having this complication. There is also obviously, we use sedation and mild anesthetic for the egg collection procedure. So there may be some complications like any other surgery that are involved with sedation and anesthetic, and again, the risk is just as similar to any other procedure to be done. There is also, of course, the risk of multiple pregnancies. There is a higher chance of getting pregnant with twins or triplets if more embryos are put back inside the woman, and the more embryos are replaced, the higher risk of multiple pregnancy is. And multiple pregnancy itself carries other risks, which, for example, could lead to miscarriage or premature birth or complications during the pregnancy. The other risks that may be involved with IVF is, of course, the risk of what happens in the laboratory. Again, we are regulated quite tightly. The embryologists that perform the technique are very talented professionals that have been trained over and over to do the techniques. But with any technique, there is some kind of risks involved, for example, failed fertilization, failed embryo development, and so on. So there are certain sort of risks that may be involved with the laboratory of IVF laboratory. Also in men that cannot produce sperm in either a natural way or have got very poor sperm count, there is a possibility that there would be some problems with their Y chromosome. And if that is the case, and that's the result, that is the cause of them not producing good sperm quality for use in IVF, or if we have to actually remove sperm from the body of the male, then there is a higher risk that if this chromosome abnormality of the Y chromosome exists, that this could be passed on to the offspring, to the future generation as well. Other than that, obviously IVF is also quite traumatic at times. So there is emotional and stress that is involved with regards to going through this process, as well as the hormones that the ladies are given can actually affect them emotionally as well. But we do provide very good support for the patients, and we provide counselling as well.
Saghar, just to quickly end off, what are the chances of falling pregnant with IVF? What is the success rate?
Sure. It has obviously since 1978, when Louise Brown was born, the first IVF baby. It has certainly, the technique has improved immensely. I think for under 35 years of age, we're looking at around 40% pregnancy rate. Okay, and this is when women are more fertile and we can get a good number of eggs produced by them. I would say probably just under 40, but around 40% figure. Different clinics and different age and various etiological problems that lead to the infertility obviously contribute to how well the outcome and the pregnancy rate is. So it's not just based on the figures that I'm giving you now, but around 30% pregnancy rate for women that are around 35 to 37 years old, and around about 20% for women that are around 38 to 40 years old. And the pregnancy rate is about 11% for 40 to 42 years old. But as I said, other factors do affect these results as well.
Thank you. Thank you so much for talking to me today.
Thank you.